Welcome back. It is said every breakthrough starts with a question, and our next guest is asking the big ones. From tackling aggressive breast cancers to exploring innovative therapies, she's on the front lines of research that could change thousands of lives. Joining me now is the Vice Chairman of Gateway for Cancer Research, Dr. Stacey Stevenson. It is great to see you.
Good to see you, Gail. Happy to be here.
So it's Breast Cancer Awareness Month. What's on the forefront right now, Dr. Stevenson?
Well, on the forefront right now are some really sea change statistics, and the really, really good news is that survival is increasing. So total volume of survival is significantly increasing. Unfortunately, breast cancer identified cases are increasing substantially. So it's a little bit of sweet with the sour, but a lot of that has to do with much more early detection. Also, the increased cases also have to do with our improvement in treatment, combining integrative therapies, combining nutritional therapies, food sciences. Advancements in immunotherapy is very critical in enhancing that overall lifespan and increasing the cure rates and increasing the survival rates. So that's probably number one that's on the horizon right now, are very tailored, individualized, designed for each patient, harnessing their immune system and their unique cancer in their unique body to move their immune system in the right direction and maintain those curative achievements. That's what's truly on the horizon. Oh, not on the horizon, it's now. It's been now for a while.
I want to talk to you about some screening modalities that are coming on the marketplace. And I'm only here to share what people have told me, and you can feel free to shoot this down. But an oncologist came on our show not long ago questioning mammograms, which are the first line of defense. I'm not taking credit away from them, but wondering if that technology and the radiation is as helpful as we had thought it should be. And should we be looking at other ways to screen for breast cancer? What are your thoughts?
This is a tough one. This is a trend right now that makes me very, very nervous. We've worked really hard in the community health and public health realms and healthcare realms for decades to get all women access to basic mammograms in all different cultural settings, all different economic settings, all different political settings around the world. And it would... nobody loves radiation, but it has improved immensely. And I personally feel like it's a little bit irresponsible to suggest to women to not get their screening mammograms. They're inexpensive. They're available. They are what have been saving lives. They're integral in increasing our early detection rate. Now, are there new things that are coming along? Yes, there are. The MRI is excellent. It's very expensive. It's harder to access. It requires much longer of an analysis. There are evaluations and testings and thermography, and we hope to have blood tests someday. They can just take a drop of blood and get early detection. That all is being looked at and being evaluated and being researched. But I personally, our message at Gateway for Cancer Research and in the cancer sort of traditional community, which interestingly, I'm an integrative medicine doctor, so I'm the first one to say, hey, lower the radiation. But on this one, I say the opposite. Get your screenings, stick to the schedule, get your mammograms. It's going to save your life at this stage.
I appreciate you answering that question, because we don't want to just float thoughts out there without having somebody step in with a counter opinion. And with your research and with your knowledge, we certainly appreciate that. Any words to women about taking their breast health into their own hands before we close out?
Well, I think taking into your own hands is protecting yourself, being an advocate for yourself, that if you have any concerns, lingering concerns, even if you see one doctor and, everything's okay, if you think it's not, if you have symptoms, if you have any changes in the characters of your breast, from skin changes to pain, not pain, soreness, not sore, anything, lumps, bumps, you name it, and you don't get answers that satisfy you, to give you calm and peace that you have done your due diligence and feel comfortable, keep going. Get another opinion. You never have to just trust one professional. It doesn't insult us. You're not going to hurt us. You're only going to hurt yourself by not getting other opinions. So I would always encourage people to keep seeking help if you don't feel good about the answers that you're getting, because some of these things are intricate to understand. It's not just always this obvious, oh, we found a lump and it's cancer and here we go and here's what we do. It's not always that clear. You may want to sample 2 or 3 other types of physicians and specialties to really educate yourself. And here's why, and that would be my closing words. Your first steps in a diagnosis, the very first things you do from a treatment perspective, are the most critical and set your course for the rest of the therapy. So your first moves are the most critical, and that's where you want to build your team and your best diagnoses.